Hi, my name's Aidan and I'm a physio here at Narrabeen Sports Medicine Centre. We see a variety of musculoskeletal conditions, but more recently in the new year, we've seen a few patients with shin pain. Typically, these types of pain can result from overtraining or overuse. Often they are tolerable to start with before becoming increasingly worse, and it starts to interfere with training. Usually we see this in runners and field sport athletes that have ramped up their training in the lead up to an event or a game. Most of the time, you see the patient when it's only limiting their running performance, but sometimes it can start to creep into their day-to-day and affect their activities of daily living. Recently, I saw Alex, a recreational runner, presenting with a 4-month history of pain in the front of the shin just into the lead up to an ultramarathon race. Alex pushed through her pain with training to a point where some days she had extreme difficulty weight bearing. She couldn't walk her dog, she couldn't go for a run. It was really tough. When I initially assessed Alex, the area in the lower half of her shin was painful to walk on and pretty tender to touch. Soon enough, Alex was sent for an MRI scan, which revealed a high-grade stress response in the shin. Stress response in the front of the shin typically occur when the bone is not tolerating the repetitive pulling of muscles and tendons connecting the shin to the arch of the foot. These injuries are often associated with activities like running, as running places a large demand on these structures to absorb and propel force through the foot. As a result, repetitive and excessive strain on the bone can occur from running too much and too often. This can also be exacerbated by reduced capacity in the musculature surrounding the foot and the ankle, as well as the bony architecture of the foot, both factors contributing to poor foot mechanics and the potential for increased pulling on the bone. Alex was rested for a period of 8 weeks to allow adequate bone healing before gradually reintroducing impact into her exercise program. During these 8 weeks, however, Alex received intensive physiotherapy. To settle things down, initial physiotherapy included taping and massage to offload the bone. But as soon as the bone started to recover, the focus switched very quickly to exercise therapy to optimally restore the mechanics in the foot, the ankle, and the whole lower limb. Alex had to earn the right to progress through her rehabilitation, going through the phases of improving pain, range of motion, control, strength, and eventually impact training. It is also in this period that we referred on to podiatry for assessment and treatment of foot and ankle mechanics. With the mechanics and the foundational movements set, this allowed us to progress Alex safely through her return to running program. Return to running for a high-grade stress response requires attention to detail. We focused on achieving the optimal jump and hop strategies and took a lot of time to analyse and improve Alex's running technique, all whilst improving her capacity to tolerate the physical demands of running. Thankfully, that was made easy with our Alter-G machine. The Alter-G is an anti-gravity treadmill which allows injured or recovering athletes to continue their aerobic fitness without the impact of normal running. Athletes are gradually weaned off the Alter-G to a progressive and regimented running program. It needs to be emphasised that throughout the rehabilitation journey, around the management of her training load was a key focus. She was also referred to our in-house sports dietitian to adequately manage her diet, which is essential for the maintenance of good bone health in female athletes. Alex is now back running on the road, on track for a return to an ultramarathon race in a couple of months. Thanks for watching, and we'll see you in the next video.